Hi, and welcome to our video on how to qualify for and apply for CDPA. CDPA is what we call the Consumer-Directed Personal Assistance Program. This is a form of self-directed home care that allows a person with Medicaid to self-direct their own personal care, home health care, or skilled nursing services, including hiring, training, supervising, scheduling, and firing, if needed, the personal assistants, or PA, of their choice. So how do you qualify to use CDPA? We've broken it down into a few simple steps. Step number 1. In order to use CDPA, you must have health insurance coverage through Medicaid. Medicaid is a free federal and state insurance program which is available to low-income and disabled New Yorkers.
Step 2 to get started in CDPA is to contact the New York Independent Assessor for an assessment. If you have Medicaid and are ready for the next step, contact the New York Independent Assessor, or NIA for short, to determine that you're eligible for CDPA. NIA assessments are carried out by a private company called Maximus under the direction of the New York State Department of Health. The person calling for the evaluation needs to be the consumer or designated representative. To schedule a NIA assessment, call 1-855-222-8350.
The New York Independent Assessor or NIA assessment process includes the following steps. The first is a community assessment by a nurse. These may be done in person or via telehealth and should be scheduled within 14 days of calling for an appointment. That number is 855-222-8350. That's 855-222-8350. Then the clinical assessment or medical assessment is done by a healthcare provider through the Independent Practitioner Panel or IPP in person or via video call. During this step of the process, you must be evaluated by the IPP, not your own doctor. After these two assessments are completed, the NYIA will send an outcome notice saying if you are approved or denied. If approved, you will be sent information to choose a managed care plan or be referred to your local Department of Social Services, LDSS. This approval is good for 1 year.
Hi, it's time for step 3. Your managed care plan or the Department of Social Services will use the information from the New York State assessment to develop your plan of care, then authorize specific hours and issue you a final notice. For most people, that would be the end of step 3, and you can move on to step 4. However, for those of you who are in need of 12 hours or more per day, we'll have to do a little more work. Consumers found in need of 12 hours or more a day must see the independent review panel. This is an extra step that is only for new consumers found in need of 12 hours or more. The independent review panel recommends whether a proposed plan of care is reasonable and appropriate to maintain a healthy and safe environment in your home. The independent review panel recommends changes to the plan of care, but not specific amounts of hours. Your managed care plan or the county may consider changes based on the independent review panel's recommendations. After reviewing the independent review panel's recommendations, they will issue a final plan of care, hours, and notice to you. You will also receive information on how to appeal this decision if you're not satisfied.
Finally, you made it. Step 4. Choosing a fiscal intermediary and hire personal assistants. Once you have been awarded your hours, you may contract with a fiscal intermediary and begin hiring personal assistants. What is a fiscal intermediary? A fiscal intermediary is a business which is responsible for paying your personal assistance, making sure all taxes for Medicaid, Social Security, and other legal requirements are paid, and making sure all required paperwork is submitted and on file for you and your PAs. New York State's Medicaid program requires every CDPA consumer to use a fiscal intermediary. You can look at our resources on choosing and changing fiscal intermediaries to help you make that decision. You can find that link in our description.
Who can I hire as my personal assistant? Under New York State laws and regulations, you have the freedom to hire nearly anyone to work as your personal assistant. As a self-directing consumer or designated representative, it is your responsibility to recruit, train, supervise, schedule, and terminate your personal assistants. Personal assistants must be at least 18 years of age, legally able to work in the United States, and willing to undergo an initial and ongoing health screenings as required by law. A personal assistant cannot be the consumer's parent if the consumer is under 21, a consumer's spouse, a consumer's designated representative, or anyone who appears on the Medicaid exclusion list due to past problems with fraud, abuse, or other violations.